We often think about the common things, the usual vet visits for our dogs. But what about the stuff that's, well, rarer?
Mm-hmm.
Today we're going deep into something pretty uncommon, specific types of tumors in a dog's throat and windpipe. The larynx and trachea,
That's right. We're looking at chondrosarcoma and osteochondroma in those specific spots. These aren't things you see every day in the clinic. Definitely not.
which makes understanding them even more crucial when they do pop up, I guess.
Exactly. It's like needing the detailed schematic for a machine part that's almost never used. You really have to dig into the specifics.
Okay, so we've got these two names, chondrosarcoma, CSA you called it,
Yep, CSA for short.
and osteochondroma. Let's just start right there. What are they, fundamentally?
Okay, so chondrosarcoma, that one's malignant. Think of it like,
Mm,
well, the cells that normally build cartilage deciding to grow uncontrollably.
okay, malignant means cancer, potential to spread.
Right. And what makes it chondrosarcoma is that it produces a sort of cartilage-like stuff, a matrix and maybe some fibrous tissue, but crucially, no actual bone.
Got it, no bone. And osteochondroma.
That one's benign. So not cancerous, it's more like a localized overgrowth, a bump, essentially. Typically has a cap of cartilage, that smooth, hyaline cartilage, sitting on a base of bone, like cancellous bone.
Benign. Cartilage cap on bone.
Yeah.
Okay. And you said these are rare overall, like tumors in the throat and windpipe generally aren't common.
That's a really key point.
Yeah.
Yeah, for both dogs and cats. Actually, tumors right there in the larynx or trachea are just not very frequent.
Huh. Wonder why that is.
It's a good question. Maybe something protective about the environment there. We don't really know for sure.
Yeah.
But it makes these specific cases stand out.
So when they do happen, these specific types, let's talk about who gets them. For chondrosarcoma, the CSA, in dogs,
Hmm.
is there like a typical patient profile? Age, breed.
Well, interestingly, for CSA and the larynx or trachea,
Mm-hmm.
the data we have doesn't really point a finger at any specific breed or gender.
Really? No breed link.
Nope. But the age range seems pretty broad, maybe 1-year-old up to about 10 years old.
Okay, so could be a younger dog, could be middle-aged. And what about the benign one, osteochondroma?
Osteochondroma in the trachea tends to show up in young dogs, typically less than a year old.
Puppies, basically.
Pretty much. And again, just like CSA, no specific breed or gender seems more likely to get it.
Okay, and you mentioned cats earlier. Where do they fit in with these two specific tumor types, larynx, trachea?
Yes, that's a really important distinction. As far as our current information goes, neither chondrosarcoma nor osteochondroma has actually been reported in the larynx or trachea of cats.
Wow. So these are really a dog-specific issue, at least in these locations.
It certainly seems that way for these particular tumor types, yeah. Why that is? Another good question.
Fascinating. Okay, so let's imagine a dog does develop one of these. What would the owner see? What are the sort of warning signs?
Right, so the signs usually relate to breathing or, their voice.
Mm-hmm.
An owner might notice their dog's bark sounds different. Hoarse, maybe.
A voice change. Okay.
Yeah. Or the breathing itself might become really loud or noisy. We call that stertor, kind of a snoring or snorting sound.
Stir dirt. Got.
Hmm.
Mm-hmm.
Also, maybe coughing. Or just obvious difficulty breathing. The term is dyspnea.
Difficulty breathing, like
You're right.
labored breathing.
Exactly. They might also seem less energetic, get tired really easily during walks or play. Exercise intolerance.
Okay. Anything more dramatic?
Yeah, in really bad cases, it can progress to severe respiratory distress. You might even see their gums turn bluish. That's cyanosis, lack of oxygen, or they could even collapse. And sometimes difficulty swallowing, dysphagia can happen too.
Wow. Okay, those sound quite alarming. And what would a vet pick up on during an exam?
Well, the vet would likely hear that noisy breathing, the stertor, especially when the dog breathes in. Or maybe a high-pitched whistling sound called stridor.
Stridor, like from a narrowed airway.
Precisely. They'd also look for those signs of labored breathing, dyspnea, or the bluish color, cyanosis. And, it's less common, but if the tumor's big enough or in just the right spot, they might actually see a mass at the back of the throat. Or maybe feel something unusual, like a widening,
Yeah.
when they palpate the larynx area in the neck.
Okay. So the big question then, why? Do we know what causes these things? Any risk factors?
And, well, that's often the frustrating part for everyone involved. Based on what we know right now, there are no known specific causes or identified risk factors for either laryngeal or tracheal chondrosarcoma or osteochondroma in dogs.
Nothing. So it just happens.
It seems that way, unfortunately. It's likely a complex mix of factors, maybe genetic mutations, environmental triggers we haven't identified. It's an area needing more research, for sure.
Right. So a dog comes in with these signs. How does the vet figure out it's one of these rare tumors and not something, well, more common?
Good question. That kicks off the diagnostic process, which is really about ruling things out. We call it building a differential diagnosis list because, you know, noisy breathing or coughing could be lots of things, right? Especially in certain breeds.
Yeah, like a pug or a bulldog.
Exactly. So for the larynx, we need to think about laryngeal paralysis, where the voice box flaps don't open properly, or that elongated soft palate you see in brachycephalic short-nosed breeds.
Mm-hmm.
Also, laryngeal collapse, which can happen in those breeds too, uh, maybe reverse sneezing fits, or they could have inhaled something, a foreign body, or just trauma or inflammation.
Okay, lots of possibilities.
And that's not even counting other kinds of tumors that could rarely occur there. Things like rhabdomyoma, oncocytoma, squamous cell carcinoma, adenocarcinoma, the
Yeah.
list goes on, mast cell tumors, osteosarcoma, fibrosarcoma, even plasma cell tumors or lymphoma.
Wow. Okay. That's a lot to consider just for the larynx. What about the trachea, the windpipe? Similar process.
Similar idea, yeah.
Yeah.
The list of differentials for the trachea also includes other tumor types.
Mm.
Squamous cell carcinoma, again, lymphoma, mast cell tumors, leiomyoma, adenocarcinoma, osteosarcoma. And one tricky one is thyroid adenocarcinoma, a type of thyroid cancer, which sits near the trachea and can sometimes invade or compress it, mimicking a tracheal tumor.
So definitely not a simple diagnosis based on signs alone. What about basic lab work? Blood tests, urine tests, do they help?
Usually no. The standard CBC, chemistry panel, urinalysis tends to come back normal in these cases, which is unhelpful in one way, but good in another, I suppose.
Doesn't point you towards the tumor, but doesn't show other big problems either.
Right. But what can be helpful early on is checking oxygen levels. Using a pulse oximeter or doing an arterial blood gas analysis gives us a sense of how severely their breathing is actually compromised.
Okay, that makes sense. What about looking inside? Imaging, x-rays?
Yeah, imaging is key. Regular x-rays of the neck, cervical radiographs are sometimes done, but honestly, they often don't show these tumors unless they're really big. The soft tissues just don't show up well.
So x-rays might miss them.
They might. Ultrasound of the neck can be a bit better. You can sometimes visualize a mass in the larynx. And importantly, it can help guide a needle if we want to try and get a sample, like a fine needle aspirate or FNA.
Ultrasound-guided FNA. Okay.
Mhm. For the trachea, though, and also just generally, we definitely recommend chest x-rays, thoracic radiographs.
Why chest x-rays?
2 reasons mainly. 1, to get a better look at the part of the trachea that's inside the chest cavity. And 2, crucially, to screen for metastasis to see if the cancer, if it is cancer like CSA, has spread to the lungs.
Ah, okay. Checking for spread. And is there a gold standard imaging test?
For really understanding the tumor's origin, its size, and exactly how far it extends into surrounding tissues, computed tomography, a CT scan, is the way to go.
CT scan gives you that 3D picture.
Exactly. Much more detail than x-rays or ultrasound for this kind of thing. It's invaluable for planning, especially if surgery is being considered.
Right, so imaging points you in the right direction, but you still need proof of what it is, right? A tissue sample.
Absolutely. Definitive diagnosis requires looking at the cells or the tissue itself. So several procedures come into play here.
Like what?
Well, a sedated laryngeal exam is often done, lets the vet get a direct look at the larynx. But there's a big caveat.
Which is,
Because you're sedating a dog that might already have trouble breathing, there's a risk of making things worse or causing a complete obstruction. So the team must be ready for immediate intubation, putting in a breathing tube, or even performing an emergency tracheostomy.
an emergency airway. Wow, high stakes.
It can be. Same goes for laryngoscopy or tracheoscopy, where you use a scope, a small camera, to look directly inside the larynx or trachea. Need that emergency backup plan ready.
Okay, so direct visualization is one thing. What about sampling?
You can get samples during those endoscopy procedures. Cytology, looking at cells collected via FNA, maybe guided by ultrasound like we mentioned, or even just aspirating the mass during endoscopy can sometimes give clues.
Just looking at cells.
Yeah. But often it's not definitive enough. For a firm diagnosis, you really need histopathology.
Meaning a biopsy.
Exactly. Taking an actual piece of the tumor tissue, processing it, and having a pathologist examine the architecture under the microscope. That's how you confirm if it's CSA, osteochondroma, or something else entirely.
Okay. So that's the complex road to diagnosis. Once you have the diagnosis, what are the treatment options? Let's say a dog is in distress first.
Right, first things first. Manage the respiratory distress. Keep the patient calm, provide oxygen therapy. Anti-inflammatories are often given, typically a fast-acting corticosteroid like dexamethasone, sodium phosphate,
To reduce swelling.
Exactly. Reduce swelling in the airways, hopefully open things up a bit. And again, always being prepared for intubation or that emergency tracheostomy if needed. Stabilize first.
Stabilize first. Okay. Then dealing with the tumor itself. What about laryngeal tumors?
Depends on the tumor. If it's small and benign, surgical removal might be curative. Options like submucosal resection, kind of peeling it out from under the lining, or maybe a partial laryngectomy, removing part of the larynx.
And if it's bigger or malignant, like CSA?
Then it gets much more complicated. For large, invasive laryngeal tumors, the standard recommendation is often a total laryngectomy.
Removing the entire larynx.
Yes. And that requires creating a permanent hole in the neck for breathing a permanent tracheostomy.
Wow. That sounds life-changing for the dog and the owner.
It absolutely is. It requires significant, intensive, long-term care from the owner, cleaning the stoma site, managing potential complications, and there's a pretty high risk of complications, especially aspiration pneumonia.
Food or water going down the wrong way into the lungs.
Precisely. It's a very big decision with major implications.
Okay. What about tumors in the trachea? Are the options different there?
Somewhat different, yes. For small, benign tracheal tumors, sometimes they can be debulked using tracheoscopy, going in with a scope and using electrocautery or lasers to remove as much tumor as possible.
Just reducing the size.
Right. But the downside is there's a risk of it growing back locally. For larger tumors, or malignant ones like CSA, the preferred treatment is usually resection.
Cutting out the affected section.
Exactly. Full thickness removal of the tracheal segment containing the tumor, and then carefully sewing the healthy ends back together. It's called end-to-end anastomosis.
Can they always do that? How much trachea can you remove?
There are limits, of course, but generally it's considered feasible to remove and reconnect if the tumor involves somewhere between, say, 20% and maybe up to 60% of the total tracheal length. That translates to roughly 4 to maybe 8 tracheal rings.
Okay. Still a major surgery, but maybe less involved than a total laryngectomy.
In terms of long-term management, yes, generally.
Yeah.
If the resection is successful and complete, the dog can often breathe normally afterwards without a permanent stoma.
What about other treatments? Radiation.
Radiation therapy isn't commonly used for these. Because CSA and osteochondroma have so much cartilage and mineral matrix, they're generally thought to be fairly resistant to radiation. It might potentially help stabilize growth in some cases, but probably won't shrink them significantly.
Okay. And chemotherapy.
Also not considered very effective for these specific tumor types. It hasn't really been studied systematically, but the consensus is it's unlikely to provide much benefit.
Right. And you mentioned corticosteroids earlier for swelling. Any drugs to avoid or interactions?
The big one is the corticosteroid interaction with lymphoma. If there's any suspicion the tumor might be lymphoma, you really want to avoid giving steroids before getting a definitive diagnosis.
Oh, is that?
Because steroids can actually kill off lymphoma cells, making it much harder or even impossible to diagnose lymphoma from biopsies afterwards. And the treatment for lymphoma is very different, usually chemotherapy. So rule out lymphoma first if it's on the list.
Got it. Critical point. Okay, so the dog gets diagnosed, gets treatment. What happens next? Follow-up.
Yeah, ongoing monitoring is really important. It usually involves monthly physical exams, just a general checkup. Then, depending on the location, for laryngeal tumors, regular sedated exams, maybe every 2 to 3 months, to look directly at the larynx again. Check for recurrence.
And for tracheal tumors.
Similar idea. Repeat x-rays or perhaps repeat tracheoscopy every 2 to 3 months to check the surgical site or look for regrowth.
And what about checking for spread, metastasis?
Chest x-rays are recommended for that, usually every 3 to 4 months, especially for chondrosarcoma, to screen for any signs of spread to the lungs.
Okay, regular checks are key. Which brings us to the bottom line, I guess. Prognosis. What's the likely outcome? Let's start with CSA, the malignant one.
For chondrosarcoma in the larynx or trachea, the prognosis is generally considered, well, guarded.
Guarded, meaning not great.
Pretty much. It's often because by the time they're diagnosed, the disease is already quite advanced, quite infiltrative into surrounding tissues.
Making it hard to remove completely.
Exactly. Even with aggressive surgery, getting truly clean margins can be difficult. And unfortunately, local recurrence, the tumor growing back in the same spot, is fairly common.
Okay, guarded for CSA. What about the benign one, tracheal osteochondroma?
That's a different story. If the osteochondroma in the trachea can be completely surgically resected, the long-term prognosis is generally good.
Good, because it's benign and localized.
Precisely. Complete removal usually means a cure. or at least a very good long-term outcome without recurrence.
So a huge difference depending on which type it is. This has been, wow, a really detailed look at some complex conditions.
It really has. It underscores how challenging some of these rarer diagnoses can be in veterinary medicine and how important a careful, thorough workup is.
So just to quickly recap for everyone listening, we've covered chondrosarcoma and osteochondroma in the dog's larynx and trachea. They're rare. CSA is malignant. Osteochondroma is benign.
Hmm.
Signs often involve breathing changes, voice changes, maybe difficulty swallowing. Diagnosis is tricky, needs ruling out other things, often involves advanced imaging like CT, and definitely needs a biopsy.
All right.
Treatment can range from surgery, sometimes very complex surgery like total laryngectomy, to managing symptoms. Prognosis. Well, it really depends. Guarded for CSA, but potentially good for osteochondroma if fully removed.
Yep. And critically, these don't seem to be an issue in cats, at least not these specific types in these locations.
That cat distinction is really interesting. A great summary. It certainly gives you a lot to think about regarding the sheer variety of health issues our dogs can face.
Absolutely. It's a vast field.
It really makes you wonder, doesn't it? Like, what can studying these incredibly rare situations teach us about tumor development more broadly, across species, maybe even in humans?
That's a fascinating thought. Sometimes the outliers, the rare cases, hold unexpected clues.
Or just thinking about the veterinary progress itself, the ability to diagnose these things with CT scans, perform these intricate surgeries. It's pretty amazing when you stop and think about it. What other hidden complexities are still out there in animal health just waiting for us to uncover?
Exactly. There's always more to learn, more to understand.